Welcome, everyone. Thank you for joining. My name is Jay Cranston, and I'm the marketing manager at Signifier Medical Technologies. We have an exciting event for you tonight where we will be exploring the use of eXciteOSA therapy for treating sleep apnea among veterans. We'll go through some clinical benefits, practical considerations, and real-world applications of this innovative treatment. And you will gain insight into how eXciteOSA can be implemented in the clinic, improve patient outcomes, and enhance overall care for veterans with sleep disorders. So let's start by introducing our panelists of experts today. We have Dr. Supriya Singh, who is the Sleep Center Director in the Houston, Texas VA. She brings a wealth of experience and expertise in sleep medicine and healthcare leadership. She's spearheaded initiatives to optimize diagnostic procedures, reduce wait times, and enhance the overall patient experience. And she is also committed to the educational aspect of sleep medicine by training the next generation of sleep physicians in the program director role. Welcome, Dr. Singh. Thank you for joining us.
Thank you.
We also have Dr. Johnathan Barkham, who is the Director of Telemedicine and Director of Sleep Medicine at the Ann Arbor VA. He's a board-certified physician in internal and sleep medicine with extensive experience in veteran healthcare. His work focuses on providing innovative care solutions for veterans, particularly in the areas of sleep disorders and telemedicine. Thank you, Dr. Barkham.
Thank you.
And we also have Irene Wong, who is a sleep medicine nurse practitioner at the Orlando VA. She's worked at the Department of Veteran Affairs since 2010 with over 16 years of internal medicine, surgery, hospitalist, and geriatric medicine experience. And she also has extensive experience in surgical oncology, thoracic, and vascular surgery, as well as palliative and acute care. Welcome, Irene. Thank you for joining.
Thank you for having me.
Okay, so on tonight's agenda, I'm going to go through a quick introduction to eXciteOSA for those that may be new and just learning about eXcite. And then we will get into the good stuff, which is the panel discussion. And these are the topics that we will be going through. So general experience with eXciteOSA, effectiveness and patient outcomes, patient adherence and satisfaction, practical considerations in the VA, and final thoughts. And we will have a Q&A segment at the end of the webinar. So please feel free to enter your questions into the Q&A feature in the Zoom webinar platform. Some of these will be answered directly in the chat throughout the webinar, but we will hold off till the end to start asking the panelists these questions. And if we don't happen to get to all of them, we will make sure that we respond via email to those attendees that sent the question. So without further ado, we will go ahead and get started. So eXciteOSA is an FDA-authorized non-invasive daytime therapy for mild obstructive sleep apnea and snoring. When we look at some of the background information on what other treatments there are for OSA, we have positional therapy devices, oral appliances, positive airway pressure, CPAP, APAP, BPAP, and implanted devices, hypoglossal nerve stimulation. So we're just looking to see on the treatment continuum when we're looking at primary snoring, mild OSA, moderate OSA, and severe OSA, and what treatments work. So eXciteOSA falls within, right now, the primary snoring mild OSA. It is indicated for mild OSA. However, there is clinical research ongoing for moderate OSA as well. And eXciteOSA is a daytime therapy that uses intraoral neuromuscular electrical stimulation. So what does that mean for eXcite? So let's talk about the role of the genioglossus in OSA pathophysiology. The largest upper airway muscle is the genioglossus, and it's necessary and sufficient for maintaining upper airway patency. So as in all skeletal muscles, the genioglossus consists of type 1 slow twitch, type 2A fast twitch, and type 2B fast twitch. So there was a mechanistic study done at UCSD, and it maintained that the tongue did have the same strength with the 6 weeks of therapy, but it increased its endurance significantly. So what does this mean with endurance in the muscle fibers? If we look at it like a marathon runner and a bodybuilder, A marathon runner has more endurance, so type 1 slow twitch fibers than a bodybuilder. But a bodybuilder can't run around the block without getting tired, but they can lift heavy. A marathon runner can run miles without getting tired, but they're not as strong to lift like a bodybuilder. So, looking at this, one of the questions I think people have is, does your tongue get bigger or bulkier? And that's not the case. So with NMES, neuromuscular electrical stimulation, it's a low frequency. So it's not going to lead to stronger bodybuilder type skeletal muscles. The lower frequency relates more to the marathon runner. So it's going to be leaner muscle carrying more endurance and reduce fatigue. So this is going to allow the tongue to be able to maintain its position in the airway so it doesn't collapse. So if we look at intraoral neuromuscular electrical stimulation, we see apneas and hypopneas are caused by collapse of the upper airway. So studies have demonstrated that patients with OSA have reduced genioglossus endurance. What eXciteOSA does is it stimulates the genioglossus with targeted electrical currents from 3 to 20 hertz. NMES at similar frequency causes fast to slow twitch muscle fiber transitions in skeletal muscles, and it's hypothesized that intraoral NMES also promotes a shift from fast twitch to slow twitch fibers. eXciteOSA is associated with significant AHI reductions, and you'll see that as I go through some of the clinical trials. And a recent study reported increased genioglossus endurance associated with eXciteOSA. So now I'm just going to show a quick video so you can get an idea of eXciteOSA and how it works.
Aim of improving endurance of the upper airway dilatory muscles. eXciteOSA provides a novel daytime therapy for patients with mild OSA and primary snoring. A compact device supplies low-frequency neuromuscular electrical stimulation, NMES, via 4 electrodes that rest directly on the tongue, stimulating the upper airway muscles. Simple and comfortable to use, the daytime therapy requires only 20 minutes of NMES each day to increase responsiveness and prevent excessive relaxation of the tongue muscles during sleep. According to clinical research in skeletal muscle stimulation, NMES has been shown to result in a change in myofibrillar protein expression to induce a phenotype shift from fatigue-prone to fatigue-resistant fibers with the strengthening of the cytoskeleton. In summary, eXciteOSA's innovative, clinically proven daytime therapy trains the tongue and upper airway muscles to be more resilient against mild OSA and snoring.
Okay, so let's look at the clinical experience. So the therapy is run through an app. You'll see here, the mouthpiece is soft medical grade silicone. And as you saw in the video, it has those 4 electrodes in contact with the tongue to stimulate. And there are 2 phases. So phase 1 would be the 20 minutes during the day, 1 time a day for 6 weeks. And then to maintain that, you're going to go into a phase 2, and it will be a minimum of 2 days a week. So it doesn't necessarily mean they can only do 2 days. They can do more than that. Some people do every other day. But again, you want to maintain that. So let's say you work out and you just stop working out, you're going to lose that endurance that you've built. So the maintenance phase is important. Again, a minimum of 2 days a week. Now, it's really like a gamified app. It's a coaching program, really, that helps patients adhere to therapy. So there's different checkpoints. So there's email, text notifications if they fall off, notifications within the app, and there's different phases if patients don't follow the therapy. So if they fall below 70% adherence, the app will actually bring them back to day 1, therapy 1, to get them back to the start and follow the therapy as prescribed. And actually, our real-world evidence paper that we have out is showing 81% adherence rate. So we think it's attributed to this easy functioning app that allows, again, those notifications to keep the patients going. So with the stimulation frequencies, it's 20 minutes. Every 5 minutes, it's a different frequency. From 3 hertz is like going for a walk, 10 hertz is going for a run, and 20 hertz is full contraction. and it's going to be 6 seconds on and 4 seconds off. The stimulation levels range from 1 to 15. 1, you don't really feel anything. 2 is a little bit of a tingle. And then 3 to 5 is where most people start their first few therapies. But eventually, we want to see patients reach 10 to 13 as soon as they can. The tolerance to stimulation varies by patient and generally increases over time, but patients should use the therapy at their highest tolerable level. So just to go through some of the clinical trials. So here we have a multi-center study of 15 participants. 50 were primary snorers and 65 mild OSA patients. And there was statistically significant reductions in bed partner reported snoring assessed in a 2-week diary, and statistically significant reductions in objectively measured snoring above thresholds of 40, 45, and 50 decibels. And 40 decibels is the threshold that the WHO uses to define nighttime noise pollution. And with this, for the usage, 83% of sessions were completed. Now, if we look at the impact of eXciteOSA on OSA severity, so this was with the 65 participants, amongst all with mild OSA at baseline, eXciteOSA was associated with a 33% reduction in the AHI on average, and 78% were identified as responders. These participants experienced a 52% reduction in the AHI on average. And in a subsequent trial at UCSD, participants with mild OSA experienced a 57% reduction in the AHI on average. And here we have the usage 86% of days. So that goes through the mild OSA. And then just on adverse events related to eXciteOSA, there are no serious adverse events that were reported. 85% of study participants did not experience any related adverse events. And the reported side effects were limited to each 20-minute therapy session with no ongoing effects. So with the device now, we want to make sure that people coach patients to kind of go into a stiff position rather than looking at their phone, because saliva pooling is actually one of the most common that we hear from patients. Eventually, they become used to the therapy, so it's not going to be happening as much. But to start, it's good to have them in a kind of stiff, upright position and not be looking down, because otherwise the saliva could pool into the device. Okay, so enough of me talking. I want to go ahead and get into this exciting panel discussion that you all are here for. So thank you again, Dr. Singh, Dr. Barkham, and Irene for joining us. So to start, I'm going to just go into the general experience with eXciteOSA. So let's start with Dr. Singh. How did you first learn about eXciteOSA, and what drew you to consider it as a treatment option for your patients with sleep apnea or snoring?
Absolutely. So many of our younger veterans, although we know that the CPAP is the gold standard, but using a CPAP, the mask, etc., can be very challenging. So the more tools you have in your toolbox, the better off you are for the veterans, just to give them more options. One of my colleagues in the VA in Virginia actually was mentioning that he started using the eXciteOSA, which prompted my interest a couple of years ago. And that's how I ended up getting this device. Our prosthetics was the one who let us order it. So ordering was never an issue. Our patients were excited using it. So we started commonly using the eXciteOSA.
Great. What about you, Dr. Barkham?
So I think I heard about it from a patient a couple of years ago. They had asked about it, but I wasn't familiar with it. And so we brought you guys in and you guys gave a presentation. And my colleagues and I all agreed to give it a shot on some patients. And we tried it out on several patients with, as indicated, for mild sleep apnea. And all of them said their snoring improved. They're very happy with it. These were much like Dr. Singh's patients, a younger population, familiar with, tech savvy people. And so we had pretty good results, and we kind of kept using it from there in different cases.
Great. And what about you, Irene? How did you hear about it?
Do you remember the first sleep medicine conference after COVID when we were all allowed to get together? And then do you remember, I think all of you remember at the VA, the great CPAP shortage, and we couldn't get access to patients, we couldn't prescribe CPAPs to patients with mild or even moderate sleep apnea. And we had to scramble and find alternative therapies. And here you all were, an alternative to CPAPs. And so divine intervention, right? Sleep conference and eXciteOSA, alternative therapies. And we were like, wow, we have an alternative. And so I was able to meet Cami and, really be able to broaden my horizons with what was in my toolbox to be able to prescribe to patients.
Great. Yeah, and I didn't mention Cami. Cami Osborne is our Director of Clinical Research at Signifier, so she is also on with us tonight to be able to help with any questions that come through. So good. I'm glad. It sounds like it was a good introduction then to eXcite for you all. So then, Irene, have you noticed any particular type of sleep apnea or patient profile that responds best to eXciteOSA treatment?
So I'm really a purist, right? I'm a nurse practitioner. I tend to stick to the criteria. I prescribe in mild sleep apnea patients. It's really indicated, for mild sleep apnea with an AHI of 15 or below. I might be particularly brave that day and venture to an AHI of maybe 17, 17.2 or something. I think that's my high. I might get a referral from one of my physician colleagues, maybe to a 22 is my high. But I tend to stick with the mild sleep apnea patients, definitely within the apnea hypopnea index of less than 15. And that's really my patient population. I find that to be the most effective for my patients. Or I might use it on occasion for patient as an adjunctive therapy for patients with a higher apnea hypopnea index. So that tends to be my patient population. But as a nurse practitioner, I also see the patients with mild sleep apnea, patients who are just starting out with PAP therapy. My physician colleagues like Dr. Singh and Dr. Barkham tend to see the much more complicated patients than I do than as a nurse practitioner. So their patient experiences are a little different than mine at the Orlando VA.
Okay, great. So Dr. Singh or Dr. Barkham, what complicated patients are you looking at? What's your patient profile look like?
I can go first. So yes, certainly, just like Irene, we certainly use it for mild sleep apnea patients, but we also use it for moderate and severe where there are no treatment options. The veteran is saying that they won't use the CPAP come what may. They are older, so they cannot be given an oral appliance. So some therapy is better than no therapy. So those are the situations where I will offer eXcite, because even if their snoring or sleep apnea index comes down by a little bit, it's a win for us and for the patient. The other patient population that we have tried it on are those who have Inspire, which is the implanted device for sleep apnea. And we find out that their apnea hypopnea index, the sleep apnea index, is better, but it's still there. And the snoring is what's bothering the patient and their bed partner. In those situations, we have offered eXcite with very good results.
Great.
Yeah, so I have obviously used it for snoring and mild sleep apnea. I think that's its strongest arena to be used in. I have used it in a few other patients that there were no other options, much like Dr. Singh. All of the patients, regardless of severity, claim that the snoring has improved. So whether, this more severe patients, I don't think, in my experience, we've corrected the HI to normal, but there's been an improvement. So I can't say we very much on that point. And I haven't applied it to patients with the Inspire therapy, but that's a thing I'd be willing to try. I didn't know that. I didn't think of that in that case, but it's a good idea.
Great. Irene, what does your patient setup look like in the clinic? Are you doing remote or in clinic
It
setup?
depends. Everybody comes technical, and their technical challenges are different, right? I had an 89-year-old gentleman. He lived an hour and a half away. He's like, Irene, I have an iPhone. I can do it myself. I have a 47-year-old gentleman who's like, Irene, I just can't. And so I have them come into my office. We download the app together. We do our first session together. So it just depends on the patient himself or herself. So it really depends. Sometimes we do video visits together where we download the app together. We do the first setup. Of course, the very first instruction is when you first get the eXcite device, I need you to plug in your device and have it fully charged first. That's the first piece of instruction that I provide to them. I also send them the instruction sheet that eXciteOSA provides to me. I always mail it to them ahead of time. I tell them to stick it on their refrigerator until they get their device, read it over first, and then if they have any questions, they can reach out to me first. So the app is very friendly. One of the draws to eXciteOSA is the technical support, not just a remote setup, but the 24/7 chat support available to them after they download the app, the 1-800 number that they can call for support and for assistance. I've been in a bind where I don't know what to do, and I call the 800 number and somebody calls me back for assistance. So, and I can always reach out to somebody at Signifier also for assistance when I don't know what to do. So, depending on what the patient needs are, whether it's a face-to-face visit, a lot of my patients are technically savvy. They're able to set up the device themselves. Some people just need me to hold their hands in clinic, and we do the first visit together. At Orlando VA, we don't have the clinic space to be able to set up our own eXcite clinic. I know some other VAs have the ability to do that. We don't. So it just depends on the individual needs of the patient.
Okay, great. And what about you, Dr. Singh? How's your patient setup?
So in our facility, when the CPAP shortage had come about at that time, patients who had mild sleep apnea, we created a mild sleep apnea clinic where we had both VVC, the video visits, and the face-to-face visits. So during that visit, the veteran comes in, and if they tell us that, yes, we are willing to try the eXcite, then real time, us, along with our respiratory therapist, sit down with the patients, go over the steps, tell them how to use it with a demo model that we have. If they are in agreement, they are willing to use it, we order it through the prosthetics. Something recently that we were made aware of is that one of the companies that works with us here in the VA has respiratory therapists who can do this for us, go out. So sometimes if we are booked far out and access can be an issue where the setup might be delayed, we reach out to this company and have them do the setups for us so that treatment does not get any further delayed.
Awesome. Yeah, it's interesting to see how the different VAs do different setups. And I did hear you say respiratory therapist, so I do just want to shout out it is Respiratory Therapist Appreciation Week and also Sleep Technologist Appreciation Week. So shout out to them. Dr. Barkham, I'm going to start getting into effectiveness and patient outcomes. So I was curious what kind of feedback you've been receiving from patients that use eXciteOSA regarding, let's say, comfort or usability or the effectiveness.
Yeah, so mostly positive. Everyone who's been able to get through the 42-day treatment protocol has expressed improvement in their snoring and their symptoms. As far as people that dropped out, I've only had a couple. One because he could not do the app, and he was an older gentleman. And we have on-site virtual support for people with app-guided therapy, and we still couldn't get it to really work out. So that was a kind of a bummer for him. And then the other case was the patient had severe gag reflux, so could not tolerate it. But for the most part, everyone's tolerated it. And then thereafter, they do the minimum 2 days, some of them every day. But I ask them to do, I recommend every other day, actually. And so, but yeah, mostly positive, actually. And I think in treating mild cases, it's better tolerated than a lot of other therapies. In my, doing convincing a young man in his 20s to be on a CPAP the rest of his life or to use this device is much easier. So that's pretty much it's not a hard sell. Usually, I start with just I have a little bit of a different practice. We have a staff shortage here, so I don't have the means to set up a special clinic. But I usually give them the handout to read, or I mail it to them if we're doing virtual, and then have them come back to me. So there's some buy-in. They've read about it, they've thought about it, they've maybe hopefully watched a few videos on it, and then it's we move on from there. So I give them a little more time to think about it when it's mild cases.
Great. And yeah, I mean, when you're talking about other treatment options, right? There's going to be feedback I'm sure you're hearing from other people with masks and having to wear hoses at night. So this is a great alternative, right? So you're not having to wear anything at night.
Yeah.
What about you, Irene? Are you hearing any feedback about the usability effectiveness from your patients?
Um, so I, when it comes to deciding treatments, I let my patients decide what treatments they want. I actually explain all the different modalities and I let them choose. And they're going through what they're capable of. I had one gentleman when they were deciding whether they could do eXciteOSA therapy, he was like, nope, Irene, I have ADHD and there's no way I'm going to be able to do every single day for 6 weeks. And that was actually very thoughtful and insightful for him to be able to do that. Because phase one is, you have to be able to do the therapy every day, or almost every day. So that was, for him to say, I I won't be able to be successful to maintain the therapy every day. So I let the patients choose what modalities they're capable of keeping track of, and in with veterans, they also think about you know I also discuss PAP therapy. Are you going to be able to wear a mask on your face? Are you going to be able to put in the reps, to put in the time to wear a mask and get used to therapy? And so they're thinking about their treatment options. They're thinking about the modalities and whether they're going to be able to, do the treatment option. So I'm getting buy-in from them and whether they're able to, hang in there with the different treatment options. As a nurse, I'm at the bedside and I'm probably explaining things in graphic details, but they're in that moment with me. And so, when by the time I have buy-in, they're, they know what to expect. And they know, by the time they get the device, what to expect.
Great. Yeah. Education is important, especially for something new and something using NMES that I'm sure they may not be sure what that's actually doing to their tongue. So education is very important for sure. Dr. Singh, so what does the patient follow-up look like for you? Are you doing it at a certain time within their therapy, a certain day? How does that look for you?
So once they have started the therapy, within 4 to 6 weeks, we have a virtual visit with the patient to ensure that they're using it. If they have any issues using it, we troubleshoot and help them out with that. We give it another 6 weeks. We do like to repeat a sleep study based on their AHI. So if they're starting off with moderate degree of sleep apnea, we often have just given them a portable sleep study that they can be mailed. The machine can be mailed out to them. They use it in their home. So with the cloud, we are able to get the data. So yes, we base it on the symptoms that, yes, my snoring is getting better. My bed partner is not as affected. But at the same time, we do like to see some concrete numbers, hence the reason we repeat the portable sleep study.
Okay, great. And so throughout the therapy, how quickly are your patients typically seeing improvements in their symptoms of snoring or sleep apnea?
So I would say that the majority of them, within 2 to 3 weeks, the snoring is most certainly better. And then they are able to vocalize the fact that they do have more energy levels in the morning. So our younger patient population, a lot of them, they tend to use it at work actually during their lunchtime. They tend to use it. So thankfully, adherence to this device has been great, which I think makes a difference as well in the outcomes, that they do see the benefit sooner than later. So I would say within 2 to 3 weeks, the snoring is better. And then, so sometimes with mild sleep apnea, just because it's mild, they are not as affected by the gasping and the choking because it's just mild. And that's where these concrete numbers with the sleep study are very helpful as well. But yes, snoring is the first symptom that typically goes away, is what my experience has been.
Okay. Dr. Barkham, are you seeing similar results, like 2 to 3 weeks? They're starting to see some improvements in your patients?
Yeah, around 20 days is where I usually see or hear that they had improvement when I ask about that. Um, and as far as like objectively testing, and a lot of the patients, the snoring's better, their wife's not complaining, so they're happy. And I offer in-lab testing to see if we need to do more. Many of them aren't interested in retesting. But we had one case, I believe it was a pilot, so we had to retest, and there was a significant, pretty much resolved the sleep apnea. So we had to kind of go through that. But overall, yeah, we do see an improvement around 3 weeks.
Okay, great. Now, are there specific metrics or outcomes you track when monitoring the progress of the patients? Irene, I'll pass that to you.
I treat the outcomes like I would treat with a mild sleep apnea when I treat with the mandibular advancement device, right? I don't retest. And I base it on clinical presentation. How are you feeling? Are you sleeping better? Are you better rested? Are you less fatigued? Is your snoring better? I reassess, I want to see them at 8 or 12 weeks, depending on when I can get them back into clinic. When I had more availability in clinic, I would see them at about the 8-10 week mark after the device was issued. And so clinically, it would be based on clinical presentation, just like the mandibular advancement device for mild sleep apnea. But that's my patient population. If they have moderate or severe sleep apnea, I would retest with a home sleep study. So for them, it's about clinical presentation, and it's a pretty hard stop. Are you feeling better? Are you snoring better? Is your wife sleeping with you again, or your bed partner? And then we make a decision at that juncture on the road. So I don't generally retest for mild sleep apnea patients.
Okay, great. So I think just in where we are in the presentation, I think I'd like to bring up some case studies because I know we wanted to present some of those. So I'll start with you, Irene, but let me just pull up the slideshow here. So we're going to do a case study from each of you so we can understand, again, the different types of patients that we're seeing and the different types of results. So Irene, we'll start with your case here. Hopefully it's up on the screen.
Let's see. Should I be able to see the case, or is there a presenter mode that I'm not able to
Hold
see?
on, I'll get it right now.
Okay.
There we go.
All right. So, full disclosure, I'm from Orlando, VA. Oh, before I get started, I wanted to, ride on what Jay had said. For all our sleep technologists and respiratory therapists who have joined us tonight, I wanted to do a shout out to you guys. Thank you for joining us this evening. It's respiratory and respiratory care week and sleep tech week. Thank you for all you do. I couldn't do sleep medicine without you. And, I appreciate everything you do. Thank you for helping me with my CPAP settings. Thank you for helping me manage my patients. And thank you again for everything. So shout out to all the great work that you all do. So full disclosure, I work in Central Florida, retiree capital of the nation, of the world, right? So my patient population is a 77-year-old male with a wife, right, who comes in to all his visits. Sometimes my patients get to talk, but majority of the time their wives are talking. And fun fact, married men who bring their wives to their visits actually live longer. So I learned that in my geriatric, practice a long time ago. So my gentleman is a 77-year-old man, comes in, and the first thing he says is, Irene, I just cannot use my CPAP. And my wife says she is going to divorce me. And, I've been a nurse practitioner for a long time. I'm crotchety. I've, 16 years of being a nurse practitioner, going on 17. But I have to admit, saving marriages was not quite in my repertoire of, diagnosis and, treatment plans. And then the wife chimes in and she says, his snoring is terrible. Okay. You can hear him all over the house. I can't sleep. I haven't slept in years, and he won't use his CPAP. And I have had enough. And if you don't do something to fix him, I am leaving him. And now, I'm sweating. The poor man hasn't talked yet. And I was racking my brain of what am I going to do with a 77-year-old man? And Jay told you, my background is geriatric medicine. I'm like 77-year-old men. They shouldn't have to use CPAP. I have a CPAP myself. They're uncomfortable. They're not, great to use, and, what am I going to do with this gentleman? I just met Cammie. I, learned about the eXciteOSA device. So I went through his treatment options with him, right? We talked about, the different treatment options. And then he decided he wanted to use eXciteOSA. And then I did, the technology assessment. Well, how good are you using technology? And he's like, well, I have an iPhone. And I was like, okay, well, you have an iPhone. Great. We will do eXciteOSA. I told him before you come in, charge your device when you get your eXciteOSA device. So he came into my office. We did a face-to-face visit because I still had the luxury of appointment slots back then. We downloaded the app on VA Wi-Fi. And we did we logged in, we downloaded or entered all his information, and we did our first session. So his starting HI back in 2018 was 12.3. His lowest oxygen saturation was 85%. And so I don't know if you've met very many nurses, but nurses are really bossy. And I'm a really, really super bossy nurse practitioner. And I tell my patients, you can't miss any days. Okay. I know, you can miss a few days here, but I tell my patients, you cannot miss any days. One, because, your device will reset when that's not the case, or you'll have to repeat therapy. But I tell him you can't miss days, and it doesn't work as well when you miss days. And he's like, no problem. I'm not going to miss any days. I'm retired. So he missed 0 out of 42 days. And a majority of my patients don't miss days because I give that rousing pep talk about not missing days during phase 2. And I gave him the instruction that after phase 2, you can go to 2 times a week. At the end of the, phase 2, we did a VA video visit. And this is the important part. He's like, Irene, I won't be able to do a face-to-face visit because I will be in Puerto Rico. And I said, okay, no problem. We do visits in Puerto Rico as long as it's not an international country. So I said, how's it going? And he goes, well, I want you to talk to my wife. And now I'm like, all right, here we go. And the wife said, we're doing great. He's no longer snoring. I can sleep next to him and I don't have to hear him anymore. And I said, no divorce, And she said no divorce. So I feel like eXciteOSA from multiple standpoints, right? His snoring was vastly improved. His mild sleep apnea, he said he slept better. He felt better rested. From his standpoint, I didn't feel the need to repeat a sleep study. Clinically, his presentation was improved. And I saved a marriage of 52 years. So I felt like this was a great example of an older gentleman with mild sleep apnea, with vast improvement in his, snoring especially, and in his mild sleep apnea. So this was my gentleman.
Sleep divorce is a real thing. So
it is. And you hear a lot of patients coming in with wives who can't stand their husband snoring. But I've never had to save marriages before. So this is my first, marriage family therapy via, eXciteOSA. So success story.
That's amazing. Thank you. Thanks for sharing. All right, we will move on to Dr. Barkham.
Okay, well, mine's more classic, I think. It's a 32-year-old male with a history of mild sleep apnea. As I recall, his BMI was normal. He had an in-lab PSG, and it was 9.2 events per hour. These are mostly obstructive hypopneas, an oxygen nadir that wasn't too severe at 89%. We did try CPAP, but he couldn't tolerate it and wasn't really interested in continuing that therapy. So we discussed obviously all the alternatives, and we started eXciteOSA, and I talked to him recently. The snoring resolved, and I offered him a repeat study to ensure resolution. But he was feeling better and sleeping better, and he did deferred repeat testing essentially. I haven't been keeping track of their stimulation level, but I might want to after this discussion. It looks like Irene does, and that's helpful. But I kind of just leave it up in their hands as far as I tell them to crank it up as much as they can tolerate. I expect as they continue with therapy, though, the tissues will get stronger, the muscles will get stronger, and they may not need all that stimulation in the future, but so I give them the freedom to back down off of it if they feel like they can't tolerate it or they're getting stronger. But then from there on out, I recommend every other day. I do one thing before I do in-lab studies to repeat test people, I would say is that I tell them not to use the device the day of the study because I don't want to tire the muscle out. So I think that's helpful. I also tell people because of this the saliva pooling to perhaps do it before bedtime so that doesn't affect their sleep either if that's a problem for them either. So a couple little points of like management I've had to kind of incorporate with patients.
Great, thank you for sharing. Yeah, I mean, it's good to see we've got a 77-year-old and a 32-year-old, so it's nice to see kind of the different patient perspectives we have. So thank you for sharing. And Dr. Singh.
All right. So my patient was a lady, 58-year-old woman who had severe REM sleep-related sleep apnea. So we did a sleep study, and her overall AHI was moderate, but in the REM sleep, as expected in women, 46 times an hour she would stop breathing. Because of a history of anxiety and PTSD, she had tried several masks and was completely unsuccessful in using PAP therapy. So at that point, we did a sleep endoscopy and realized that she would qualify for the Inspire therapy. And she did very well after the device was implanted. She did very well, tolerated the device well. But when we did repeat a sleep study, we found that the REM AHI, though improved, was still present. And she did feel the symptoms in the sense that she was still snoring, which was very bothersome to her spouse. And along with that, she did have some mild daytime sleepiness. So we actually repeated a sleep endoscopy, and with the Inspire, when we repeat the sleep endoscopy, we actually turn it back on and try higher amplitudes, higher voltage to see how much is the airway moving or opening and how much is the tongue moving out of the way. So it did actually move quite a bit with higher amplitudes of the Inspire. But once we woke her up and tried it real time with her awake, she was unable to tolerate those higher amplitudes. They were just very uncomfortable for her. So at that point, we decided, because we knew that the tongue was still the culprit for the sleep endoscopy, so we decided to go with eXciteOSA. And she was able to tolerate it very well. She was on the therapy for 2 weeks. When I called her, did a video visit, she was very happy because the spouse was very happy. She was no longer snoring. And we sent a portable sleep study to her home. And sure enough, her REM sleep apnea index was almost less than 5. So great outcome, very happy patient and spouse. And of course, I was thrilled that we had both symptoms as well as objective improvement in her sleep apnea numbers.
Great. And yeah, I mean, it just goes to show how great this therapy works as an adjunct therapy, right? So there are still some people that are using a CPAP when they go to bed or a mandibular advancement device. So eXciteOSA is perfect because it's done during the day. So it's a great adjunct therapy option. Awesome. Thank you all for sharing your cases. Now I'm going to move on to some more questions for the panel discussion. So at this point, we're going to go into some patient adherence and satisfaction. So Dr. Barkham, how do you approach patient education when introducing eXciteOSA, especially for those familiar with CPAP or other devices?
So I think you guys provided our clinic with a lot of educational material, handouts and so forth that are very helpful to kind of introduce the piece to the patient. I talk about other patients' experience, potential problems with it, like most therapies. Usually at that point, they're already leaning towards that, because they're leaning away from the other therapies for all the reasons we're familiar with the other therapies. And so, like I kind of mentioned before, I give them the information and I let them come back and get the buy-in. I think Irene's key word there is their buy-in. They've had time to think about it, read about it, and then we can start it. It's rare that I just out of the gates just put them on it without some sort of them doing some reading on the material first, because it is a unique therapy and a little difficult to get your head around. Like, oh, I'm going to put my tongue into a device. No, you're going to put it in your mouth and it's going to shock the tongue, and explain it down to a level where they can really grasp it. So I think it has to be bite-sized education that also has to fit within your visit, which is hard to do. So that's why the patient handouts, I think, are key. The video you showed today I hadn't seen before, but I thought that was actually great, because I did have a patient that struggled with thinking how to get this in their mouth, and I think that's probably the most difficult thing, is the tongue position of, making sure you have it in the right position. And I think that video is going to be something I'm going to have to incorporate into the practice.
Great. Yeah, education is key. Education is important. So I know Irene mentioned that as well earlier. So great. Yeah, I'm glad the handouts are helping.
Yeah.
Dr. Singh, have you found that patients are more likely to adhere to eXciteOSA compared to other treatments like CPAP? If so, what factors contribute to better adherence?
Most certainly. I think the biggest factor that has been in our case is not having to use anything on their face. So our veteran population oftentimes suffers from PTSD. So having anything on their face or dealing with the hose that goes around their neck when they're turning while sleeping has been very challenging. With this device being used in the daytime, it works very well for them, because the younger veterans, their bed partner is not at all bothered anymore because they use the device in the daytime. So yes, in our case, it's been a win-win, and adherence has been great, just because, again, they can take care of it in the afternoon and it doesn't have to interrupt their nighttime sleep, because once they sleep, they are asleep. It's not that they wake up in the middle of the night struggling with the mask or struggling with the hose.
And to piggyback on that, after phase 1, I dangle you can go to 2 times a week after phase 1. So that's a carrot that I dangle too. And then they don't have to do every day after that.
Yeah, that helps for sure. I mean, I think I've heard from some patients, they're like, I want to just keep doing it every day because if it's working, I
And
feel,
that's been our case, that our patients usually just keep doing it.
yeah,
So, and we are okay with that.
great. Yeah, you mentioned PTSD. So, I mean, when we're talking about veterans, I want to start talking about practical considerations in the VA setting. And we know that there are some other, let's say, comorbidities or other medical concerns that we might want to be considering when we're talking to patients. So, again, I just want to go into practical considerations in the VA system and talk about kind of the veteran population. So, Irene, what has been your experience navigating the Veterans Affairs system to prescribe eXciteOSA? Are there any challenges unique to working with veteran patients?
Aside from getting them ordered and navigating prosthetics, you know, that's a great question. I'm trying to think about how to answer that. I think that's a general question with, I think, all of the sleep apnea therapies, right? Sleep apnea treatment is obstructive sleep apnea is all obstructive. It requires a device to remove the obstruction. So all the other treatments require something to be put on your face or put in your mouth or, stuck up your nose. There's nothing natural about any of that. And it requires you to get used to it. And I think eXciteOSA is the least invasive. It's in and out for 20 minutes and you're done. And so that's very appealing to a lot of people. I tell patients, for some reason I have a horse breeding video feed on my Facebook, right? And we train baby horses to wear halters and, equipment on them. It's not natural. And it's not natural to wear things on our, bodies. And, a lot of patients, we're not used to putting in the time and effort to put all of that on our bodies and our faces and, our body parts. And so eXciteOSA, for 20 minutes a day, it's tolerable, it's manageable. We can fit that in as opposed to 6 or 8 hours of our entire nights. And so, I think that's what makes it so appealing. And then we add the trauma, the mental anguish, the experiences they've had, not just in the military, but in their personal lives. And so that's an additional factor that we forget about, when we prescribe, PAP therapy or those other devices. So our patient population is unique, and that's what makes caring for veterans, rewarding and challenging, frustrating, mind-blowing at the same time. And that's why we, have those kid gloves on when we talk to our patients. And that's what makes us taking care of veterans, so awesome, as providers. So, those are, I think that's what makes eXciteOSA, such a valuable tool in our availability to, take care of veterans.
Great, thank you for sharing. Dr. Singh, have you found eXciteOSA to be an effective treatment option for veterans with comorbidities and complex medical histories? And how do you incorporate eXciteOSA into the overall treatment plan for veterans?
Absolutely. In patients who have comorbidities, again, if they are not willing to use the CPAP, this is the best option that we have that we can offer, number one. Number two, it's effective in the sense that they do see symptomatic relief very quickly early on, which kind of motivates them to keep on using it. We don't have long-term follow-up in the sense that what did happen to their blood pressure. But I would say that overall, just because they were sleeping better, certainly their mental health disorders that they were dealing with were very well controlled. So yes, overall, I think our experience has been great. Our veterans have been adherent to the device, and it's our job just to make sure that we supply them with the mouthpieces, etc., on a timely basis, so that they continue to use the device and keep on getting the benefit out of it.
Great. Wow. Okay. So we've already reached almost the end of the webinar, but I would like to keep going because I think this is a great conversation. We do have some final thoughts, a couple questions for you all, and then I'd like to get into the Q&A. So just a reminder to everyone on the webinar, if you submit through the Q&A features, put some questions in there and we'll answer them at the end. But again, I'd like to just ask a couple more questions and then we can move on to the Q&A. So final thoughts. So Dr. Barkham, how do you see eXciteOSA fitting into the broader landscape of sleep apnea treatment options in the future?
I think it's going to become more popular. And as we get more comfortable using it in complicated cases or as adjunct therapy, and then as more data comes back showing its effectiveness in those, situations, I think people become more confident in using it. Right now, being only really cleared for the mild cases, it's not something we're jumping to instead of CPAP for these more moderate and severe cases. So I do see that there's room for improvement in the literature, but for now, I think on a case to case basis, I'm doing in my practice, with full disclosure with the patient of what's available. We're going to we're getting more and more. I'm getting more and more experience with these other more difficult cases and more confident in its use. So I think it's going to grow, like I said. I would add, to your question before about getting it. I know different VAs they operate differently. I haven't had any difficulty getting mine through prosthetics. I put in the starter pack order with the number, the SKU number, and they get it. Now there were issues over the last year with refills of the mouthpiece. That's being resolved, I've heard, but I haven't, as far as ordering it to begin with, it's been very seamless through our VA, but I can't speak for everyone's VA because everyone has different processes and so forth.
Great. Thank you for sharing. Yeah, I mean, every therapy has its purpose, right? And like we talked about with adjunct therapy, it's just nice that there's new innovations coming out that can help these patients, and that's the ultimate goal, right? So, Irene, what would you like the other VA providers or professionals, or really just any of the other professionals on the webinar to know about prescribing eXciteOSA for their patients?
To be open-minded, to know that Signifier is here to help. They're so supportive that you can prescribe it in your entire patient population. A young man, who has PTSD, a young man who doesn't know that he wants to be on PAP therapy, an 89-year-old gentleman who's a triathlete, that's my patient, who just wants to sleep with his wife, right? The whole entire spectrum of your patients. And so, being able to use eXciteOSA has been tremendously easy for me. I saw 15 patients today. I probably talked about eXciteOSA 6 times. And so it's been a valuable tool in my therapeutic options for my patients. Probably 80% of my patients are patients who can't tolerate CPAP. And I think that's probably my patient panel, but to be able to have different options to be able to talk to patients about, and we have to think beyond just PAP therapy, and being able to talk to Dr. Barkham and Dr. Singh about, adjunctive and being creative, right, with what we can offer to our patients is only going to be able to, add value to what we're able to provide to our patients. Our patients are only getting more complicated. Google has only added to their, patient experience. It has kept me on my toes more. And so being able to offer eXcite to my patients, and having Signifier be able to, help me with, my patients and their questions has been, extremely easy. So I appreciate, everything that, they've been able to help me with in my patients.
Amazing. Thank you. Dr. Singh, Dr. Barkham, is there anything you would like to share with the VA providers or other professionals about prescribing eXciteOSA?
Absolutely. So when we started this program, certainly we were very happy that we had an adjunct therapy now to provide to our patients or just use it as a monotherapy. But we also made sure that we had the item number. We worked with the CACs and made sure it was made a part of our order set so that people, for example, we are a big training site for our sleep fellows. So just in order to make it easy so that they're not struggling with the item number, etc., we made sure that those order sets were ready, both for the starter kit as well as for the mouthpieces. And we also spoke with our prosthetic chief, made sure that they were aware that this was a newer device that we were setting up so that they knew how to proceed forward with it as well. So we worked at both the ends, both for the providers as well as our prosthetic team to ensure that it moved along smoothly.
Great. Thank you. Dr. Barkham?
Yeah. I think the only thing I would point out, you did point out in your earlier presentation, is the app guided therapy. It's actually very good and very easy to use, and the reminders I think are very helpful. So going through it, and I think that's a big part. We've all seen apps that are clumsy and difficult. That app is very well designed. I really haven't, other than once the patient gets it downloaded, I've never had anyone struggle with the app, period. And so I don't know if the other clinicians have had the same experience, but it seems very straightforward.
Great. Thank you.